Hey guys, here are my tips for low back pain or hip pain. So this could include SI joint dysfunction, degenerative disc disease, hip impingement, hip bursitis. So it's kind of a few of my favorite things I like to prescribe to target the common culprits for these injuries. So what you need, optional, a chair, and not optional, a mini band. If you don't have a mini band, you can tie a long band together. All right, we're gonna stand. We're gonna start with some leg swings. So we're gonna be here. You can hold on to the wall if you need, and we're just going to swing back and forth. Just hanging that leg heavy. This is gonna help open through that hip joint, then you can go side to side. So you can do 10 swings per way, and then switch. So forward, back. I'm not doing the full amount of reps, I'm just kind of here to show you what you can do. Good. All right. We're going to do some hip openers. So we're going to bring the knee up, we're going to bring the knee to the side, and we're going to scoop back, up, out, scoop, up, out, scoop. So you can do 5 to 10 going that way and then bringing it in reverse. Back up and around, back up. If you need to hold on for balance, feel free. Good. All right, we're going to switch. Out and around. Good. And up and back. This is a great thing to do before exercise, before and after even. Good. All right. We're going to get into our hip flexor stretch with a little variation. So kneel down, push the other leg forward so my right knee is down. My left foot is out front. I'm going to push both hips forward. I'm going to raise my right arm in the air and I'm going to lean towards the left. So you're going to feel big, strong stretching through the side of the hip and even above it. So this targets our QL, and then the TFL is the top of that IT band. So we're going to lean. You can even do both hands, lean, and hold. And we're going to switch. So right leg forward, push both hips forward, arms up. We're going to lean to the right and hold. So we're going to try and hold 20 to 30 seconds each stretch. Ideally to do each one 3 times. Good. All right. We're going to do our glute stretch. I'm going to show you the variation. So grab your chair. All right. So we're going to cross our ankle over our knee, flex those toes, and we're going to hinge forward. We're going to hold. When you feel that sensation lessen, you can rotate your body. So think like a clock. If we're at 12 o'clock here, move your body, your chest to face 2 o'clock. And then you're going to move your body and chest to face 10 o'clock. So stretching is all about angles. So always change it up in your stretches for which direction you're facing. Even the slightest change in an angle can make all the difference. Okay, if you're doing this variation, switch to the other side. I'm going to show you the other variation, which is against the wall. So we're going to scooch up towards the wall. We're going to have both feet on the wall. We're going to cross one ankle over the opposite knee. We're going to push our tailbone down into the ground, flex those toes up. Closer to the wall will make the stretch stronger. Moving away from the wall will lessen the intensity of that stretch. 20 to 30 seconds, just like the seated version. So do whatever one feels best. Sometimes in this position, the hip impingement can be bothersome. Push your tailbone down into the ground and hold. Good. All right. So we're going to do some bridge. We're going to get into some of the strength work. So both legs down, dig with the heels, raise the hips up, Keep the hips nice and level. Squeeze those glutes and lower. So when you come up, you can hold for a couple seconds and lower. The goal would be 3 sets of 10, really squeezing those glutes. If that's easy, you can do one leg and relax. 3 sets of 10, keeping the hips level. Alternatively, if you like the 2-leg variation, you can add the mini band just above the knees. So we're going to be here. Slightly push those knees into the band as you come up and lower. Up and lower. So 3 options you have there. I don't want to reproduce any pain, but fatigue I'm okay with. All right, we're going to get onto all fours. We're going to engage the core. So we're going to pull the belly button in towards the spine and hold in your P. And you're going to raise opposite arm, opposite leg, keeping the hips nice and level. What I often see is this. I don't want that. Bring that hip towards the ground and switch. Pull that belly button in nice and tight. Hold in that P and remember to breathe. If you need an added challenge, you can put a pillow under your knees and that makes it a lot more challenging. 3 sets of 20 would be the goal here. Good. All right. Lastly, we're going to grab our band. We're going to do a little bit more of a functional glute exercise. Band around the ankles. We're going to have a soft bend in the knee and we're going to sidestep. So we're going to make sure there's tension on the band. We're not bringing it fully back together. So tension on the band the whole time. Try to do 20 steps each way or see how far you can get until fatigue breaks down your form. So I always try and do 40, 20, 40, 60, 80. See how far you can get as the weeks go on. Obviously, if you need a little mini break, feel free. But feel your glutes. Make sure those are turning on every step you take. Awesome. Those are my tips, rehab tips for low back pain and hip pain. Again, any sharp pain, please stop that movement. I'd rather fatigue versus sharp pain, and hope you guys enjoy.